Hello, it's Dr. Rhonda Johnson. Today is Thursday, January 18th, 2024, and today I'm talking about race, racism, and healthcare. Well, people used to say never talk about politics, race, or religion in public or polite conversation. Well, I think that's pretty much fallen by the wayside today. But today I'm talking about just that in the context of American politics. So recently, a candidate for president, Miss Nikki Haley, stated that we have never been a racist country. Well, this is my reaction to her statement. Let's start off with the definition of the word racist as per Merriam-Webster dictionary. Now, they define racist as a relating to or characterized by racism, such having, reflecting, or fostering the belief that race is a fundamental determinant of human traits and capacities, and that racial differences produced an inherent superiority of a particular race, and B, of relating to or characterized by the systemic oppression of a racial group to the social, economic, and political advantage of another. Well, folks, doesn't that sound just a little bit like the United States of America? So moving on, let's talk about race. I want to begin by saying the concept of race is a social and cultural construct. Race doesn't exist biologically. There's only one race of human beings, and if you're a human being, you belong to the human race. All human beings are 99.9% identical genetically. Only 0.1% of the things that we see, physical traits such as skin color, eye color, shape of our noses, the hair texture, those are phenotypic differences, and they only count for 0.1% of our genetic makeup. So the concept of race was designed to divide humans into so-called distinct races based upon these physical traits for social, economic, political, and cultural reasons. Now, the concept of race doesn't exist biologically, but racism is real, and it's been a part of America since its early foundation. You know, it was justified by science. Scientific racism was used to justify the American slave trade of Africans, and scientists argued that African men were uniquely fit for enslavement due to their physical strengths and so-called simple minds. They argued that slaves possessed a primitive nervous system, did not experience pain as white people did, and that Black people were mentally inferior and our brains and nervous systems were primitive and underdeveloped. In fact, there were scientists that wrote books and reports saying that Negroes, as they were called at the time, were a whole different species from white people. So racism existed with the inhumane treatment of enslaved people, but it didn't end there. So for example, in healthcare, the Alabama physician James Marion Sims, he conducted all kind of experimental gynecological surgery on enslaved Black women without their consent, often without pain medication, and they often suffered serious complications. Medicine even developed a diagnosis called drapetomania. It was the desire of enslaved persons to run away, and it was considered a mental illness. Fast forward to the Tuskegee syphilis study that was conducted between 1932 and 1972 by none other than the United States, the United States Public Health Service, our federal government, and supported by physicians in prestigious academic medical centers. And in this study, African American men with syphilis were intentionally left untreated, even when penicillin became a known and standard cure. Then there was the example of Henrietta Lacks and her HeLa cells. She was a cervical cancer patient at the Johns Hopkins Hospital. Her cancer cells were taken during a medical procedure without her informed consent. They were found to be unique because they could divide continuously, and they became the first immortal human cell line, meaning they can be reproduced indefinitely in laboratory conditions. Miss Lacks died in 1951, but her cells are still alive today in 2014, and they've been used for vaccine development, cancer research, cell biology, and they continue to play a scientific role in progress, in science progress, and medical progress. So, my point is this: racism is embedded and institutionalized in so many aspects of American life, and racism in healthcare is just one example. So, dear Miss Nikki Haley, please learn the history and face the facts. And so, in closing, race is a fictional concept. The Human Genome Project proved this. All human beings are 99.9% genetically identical. And if we made this up, folks, we can unmake it. We can unlearn it, and we can all move to a new world where people are not viewed as inferior to others, and we can begin to dismantle racism once and for all. That's my message today. I know it's a little long. Take care.